Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. This video is for all of you out there who know that you want to go through medical and surgical transition. You pretty much know that you're struggling with dysphoria and know what your identity is, and have young children at home. And as a result, you're holding yourself back because of the young children at home, telling yourself that if you are going to go through surgical or medical transition or both, that you are going to really affect children in a negative way, that you're really going to, some even use word traumatize your children or make it life that much more difficult for your kids. This video is also for all of you who are in the same situation, but in this case, it is your partner who is telling you that if you were to go through medical or surgical or both transition, you're going to have that effect on the children at home. And so as a result, here you are struggling with gender dysphoria, want to do something about it in terms of alleviating it through medical and surgical intervention, and yet you feel like you are unable to because you feel tremendous amount of guilt because of the young kids at home. A lot of people constantly ask me, how will this affect the children? I'm so afraid that I'm going to make it life much more difficult for my kids. I'm so afraid I'm going to traumatize my kids. I'm so afraid my kids are going to be bullied at school if classmates are going to know that one of the parents is going through gender transition, and a whole bunch of other fear-based concerns. So here's what I'm here to share to all of you who are staying in that status quo, afraid to rock the boat because of the young children at home. Now, before I say that, let me be clear. Of course, I'm not a family psychologist, nor am I a psychologist that work with kids. Having said that, I have worked with tremendous amount of couples who do have young kids, and I have witnessed them go through gender transition with young kids at home of any age, from age, I would say age 4 all the way to even young adults. And I have seen how transition, in what way it has really unfolded in all of these families of different statuses, of different demographic backgrounds. So I would say I actually have probably a bigger and a better lens because I have firsthand witnessed how it tends to affect the household versus anybody else because of the nature of my work. And here's what I'm going to share with you. What I have noticed is I have yet to see young kids who, as a result of one parent going through gender transition, who gotten worse over the time. Let me say that again. I have yet to see young kids who, as a result of one of the parents going through gender transition, have got worse. What I usually see, and what I usually see affecting children the most, is one of the partners or both of the partners. It is oftentimes what I see is perhaps it's a partner of a trans person that says some not positive, negative things to the kids, especially if the couple separates, about the other parent. Or it's a partner who is not on board with the pronouns and name, and as a result, the kid feels confused. Or it's a trans person themselves who are not very present in parenting. But I have yet to see transition in of itself being detrimental to kids and their upbringing. Young kids are like a sponge. They're incredibly adaptable. What they really need is love and understanding. They need space. They need parents who listen to them. They need parents, most of all, who spend time with them, who interact with them, who create those bonds. Kids are not looking for particular gender-centric parents. They're not. They're not set on, oh, I want my whoever I call a father. I don't necessarily need my father to be assigned male or birth. I don't even know what that is. Again, what they really need is loving, present parents. Like Winnicott said, you just have to do good enough parenting. So all of these fears people usually have, all of these guilt things, they're either self-induced, they're either perpetuated through the internet and social media about how much it's going to affect the kids and how you're going to mess up your kids, or they're perpetuated by a partner as a way to keep you where you're at. Or It could be just that this is what partner fears and they genuinely believes that it's going to affect the kids. Again, kids are very adaptable. What happens when you live with gender dysphoria and you have children? What you don't even notice is you're not fully present with your kids. You think you are, but it's really hard to be fully present when there's a gender dysphoria in the back of your head space, constantly ruminating and constantly making that white noise. It's very hard to be fully present. A lot of times, kids see their parents who struggling with gender dysphoria as withdrawn and distant. And that's exactly what happens. And trust me, the last thing kids need is withdrawn or a distant parent. Again, kids are very adaptable. What I have seen again and again and again is when parents actually do come out to their kids and they actually do take steps to better their health and they start feeling better, their parenting skills become even better. They're more present with their kids. They have more time. They're more emotionally attuned. They're more intuitive. They're more receptive. All of these things are incredibly important when you are parenting a child. But the things that a lot of you tell yourself that I won't do it until my kids are adults is also in a way of a self-sabotage and a resistance. And it's something for you to examine. There's lots of things in life that are going to throw a curveball at your children, especially as they continue to grow. But the best thing you can offer them is authentic parenting and authenticity in a sense of who you are. So that way you can teach and model to kids, first and foremost, what it's like to live an authentic life, what it's like to follow what's important to you. We all know parents who, instead of allowing their kids to be authentic selves, who instead force fit the kids the ideals they have of them. We all have that. A lot of people have felt it firsthand, especially in some cultures, where parents, you absolutely have got to be a doctor or a lawyer or nothing else. Or you have to get married and have kids. Or my mom, you absolutely cannot have tattoos. I'm like, Mom, I'm 43 years old. Come on, I'm an adult woman at this point. It's kind of ridiculous. But we all know and have parents in our lives who want us to be an ideal, a fantasy of how they want us to be. The reality is that we're all individual selves, even our kids. So the best thing you can do is be there for your kids and be authentic self so that you can mirror to them how to live life authentically in all different aspects of life. Again, I cannot stress this enough. I have yet to see kids who got worse as a result of one partner transitioning. In my experience, they actually got more connected to their parent. The relationship became stronger. You create a different type of bond. So if you're one of the parents and you're watching this and you've been holding yourself back, remember, by living with dysphoria and prolonging your suffering and you struggle with it, you not really bettering your health. You're actually making your health worse. Remember how I said there are somatic aspects to dysphoria is that if you live with it long enough, some people start having physiological issues, gastronomical issues, severe migraines. All these things have been reported by individuals. So you're really not doing yourself any favor. Nobody wants to have a parent in end of line that is really struggling with a whole bunch of ailments. Everybody wants to have a healthy parent, and nobody wants to miss out on years and years and years of really good, solid relationship bonding, and only start bonding to their parents when they're adults. You kids need you now. So this is what I gotta say. If you are on the fence and you're sitting there, you allow yourself to hold yourself back, re-examine it. Is it your resistance? Is it your self-sabotage that is holding you back? And trust me, all of this stuff is complete myth. You cannot mess up your kid by transitioning. You just can't. This is your life and you gotta do what's best for you. And by doing what's best for you, by that, you're also going to do what's best for your kids as well. Comment below if you have kids, and especially if you have transitioned while your kids were young. How did it all work out for you? Like I said, usually it's not the transition itself, but it's usually either you or it's your partner. A lot of times I see it's a partner that is not on board. That is also, and I'm not trying to bash the partners, but Unfortunately, I do see that some people are seldom mindful and have kids' best interest at heart, and they tend to leverage that, especially if couple does go through divorce. Unfortunately, it breaks my heart to say that. So comment below, share what your experience has been like, and I will see you all next time. Bye.